GuidoSpine addresses spinal interventions. For one, spinal fusion by particle screw placement, and second, ablation near the spinal column.
These interventions are especially difficult due to the proximity to risk structures such as the spinal cord. This requires high precision and stiffness.
Traditionally, spinal interventions heavily rely on manual workflows, invasive tracking, and there is limited automation. Because of this, our GuidoSpine replaces the invasive tracking with non-invasive methods. We automate the planning and the execution, provide real-time feedback and adjustment, and we reduce the procedure time significantly.
The main features of the application are a non-invasive tracking system for patient tracking, which is also able to track the instruments, AI-powered vertebra and tumor segmentation, automated path planning with multi-criteria optimization, advanced stiffness and precision, a modular sterile end effector system with included safety features, the integration of 2D image calibration, which reduces radiation exposure.
Our solution reduces patient risk by allowing automated planning and execution, by supporting the clinician by instrument guidance, and lastly, by non-invasive tracking.
We joined the KUKA Innovation Award to show our transformative medical robotics system, and more important, we wanted to demonstrate the real-world benefits for patients and clinicians.
Making automation easier.